Let's see if you have strabismus. You may have heard of someone with a lazy eye, or may know someone having difficulties looking straight ahead with both eyes. Perhaps you may wonder why you struggle with your focus. Through this video, you will be able to understand what strabismus is and common causes, and how it can be diagnosed. The simplest definition of strabismus is that strabismus is a condition in which the eyes do not properly align with each other. Strabismus prevents a person from directing both eyes simultaneously towards the same fixation point. It can interfere with binocular vision and affect deep perception. There are three types of strabismus: genital strabismus, which is common in children, and acquired strabismus, which is common in adults. Estrophia, which one or both eyes turn inwards. Extrophia, where the eyes are deviated outward. Hypertrophia, axis of one eye is higher than the fellow fixating eye. Hypotrophia, axis of one eye is lower than the fellow fixating eye. Many types of strabismus can develop in children or adults, but the two most common forms are accommodative estrophia and intermittent extrophia. Strabismus occur in 2 to 5% of all children. Acquired strabismus can develop accurately or gradually. Estrophia is a form of strabismus or squint in which one or both eyes turn inward. Accommodative estrophia often occurs because of uncorrected farsightedness. The eye's focusing system is linked to the system that controls where the eyes point. So people who are farsighted are focusing extra hard to keep images clear. This may cause the eyes to turn inward. Symptoms of accommodative estrophia may include seeing double, closing or covering one eye when doing close work, and or tilting the head. Extrophia, diverted squint or wall eyes, is a form of strabismus where the eyes are deviated outward. It is the opposite of estrophia. Intermittent extrophia may develop when a person cannot coordinate both eyes together. The eyes may point beyond the object being viewed. People with intermittent extrophia may experience headaches, difficulty in reading, and eye strain. They also may close one eye when viewing at distance or in bright sunlight. Hypertrophia is a condition of misalignment of the eyes, whereby the visual axis of one eye is higher than the fellow fixating eye. Upward deviation of the eyes is usually due to a paralysis of one of the muscles that either elevate or depress the eye. Most of the time, it is due to one specific muscle, known as the superior oblique. The paralysis may be congenital or acquired. Most of the time, palagia of the superior oblique is congenital but may present itself later in life. Hypotrophia is a condition of misalignment of the eyes, whereby the visual axis of one eye is lower than the fellow fixating eye. Most strabismus is caused by refractive error or muscle imbalance, vision of both eyes that are not normal, influenced by hereditary disorders in the brain or nerves. Risk factors for developing strabismus include family history. People with parents or siblings who have strabismus are more likely to develop it. Refractive error. People who have a significant amount of uncorrected farsightedness may develop strabismus because of the additional eye focusing they must do to keep objects clear. Medical conditions. People with conditions such as Down syndrome and cerebral palsy, or who have suffered a stroke or head injury, are at a higher risk for developing strabismus. How is strabismus diagnosed? Patient history. An optometrist will ask the patient or parent about any current symptoms. In addition, the optometrist will note any general health problems, medication, or environmental factors that may be contributing to the symptoms. And secondly, visual acuity. An optometrist will measure visual acuity to assess how much vision is being affected. For the test, you will be asked to read letters or reading charts that are near and at a distance. Visual acuity is written as a fraction, such as 20/40. The top number is the standard distance at which testing is done. at 20 feet. The bottom number is the smallest letter size you will be able to read at 20-foot distance. A person with 20/40 visual acuity would have to get within 20 feet of a letter that should be seen clearly at 40 feet. Normal distance visual acuity is 20/20. Your eye doctor has other methods of measuring vision in young children or patients who cannot speak or comprehend the visual acuity test. Third, refraction. An optometrist can conduct a refraction to determine the appropriate lens power you need to compensate for any refractive error. Using an instrument called a phoropter, the optometrist places a series of lenses in front of your eyes and measures how they focus light using a handheld lighted instrument called a retinoscope, or the doctor may use an automated or handheld instrument that evaluates the reflective power of the eye without the patient needing to answer any questions. Fourth, alignment and focusing testing. An optometrist needs to assess how well your eyes focus, move, and work together. In order to obtain a clear single image of what you are viewing, your eyes must effectively change focus, move, and work in unison. This testing will look for problems that keep your eyes from focusing effectively or make it difficult to use both eyes together. Examination of eye health. An optometrist will observe the internal and external structures of your eyes to rule out any eye disease that may be contributing to strabismus. This testing will determine how the eyes respond under normal seeing conditions. For patients who cannot respond verbally, or when some of the eye's focusing power may be hidden, your optometrist may use eye drops. The eye drops temporarily keep the eyes from changing focusing during testing. Treatment. Eyeglasses or contact lenses. This may be the only treatment needed for some patients. Prism lenses. The prism alters the light entering the eye and reduces how much turning the eye must do to view objects. Sometimes the prisms can eliminate the eye turning. Vision therapy. Vision therapy trains the eyes and brains to work together more effectively. These eye exercises can help problems with eye movement and eye focusing. Eye muscle surgery. Surgery can change the length or position of the muscles around the eye so they appear straight. There are tests to determine the type and degree of strabismus. Normal eyes will have the light in the center of the pupils. For materials, you will need a small pen light. The first test is the Hirschberg test. Use a small pen light and direct it toward the eyes. The reflected point of light will reveal the type and degree of strabismus. Note that 1 millimeter displacement is considered. In some cases, latent strabismus, heterophyria, is present. The eye will normally be kept straight by fusion. To discover the latent deviation for material, you will need a translucent material, such as a plastic spoon. The second test, the cover-uncover test. Cover one eye with some translucent material, through which you can detect any movement of the eye. If there's movement in the eye, when the occluders move, then there is a latent strabismus. The latent deviation will be revealed with either eye covered. The data of the Hirschberg test are as follows. The angle kappa is the angle between the pupillary axis and the visual axis. When the angle kappa is none, diagnosis can be considered as normal. The data of the cover-uncover test are as follows. When the right eye was covered, normally the left eye does not have movement. The results of Hirschberg test are as follows. The results of cover-uncover test are as follows. We have selected an experiment for this semester that was linked to our previous semester's experiment. Our goals are to understand strabismus. Understanding strabismus' causes, diagnosis, treatment, and being able to read test results. Perhaps in the future, we may be able to do an extended studies related to domestic animals, such as dogs or cats.